That cases of cracked teeth and dental-related injuries have surged throughout the pandemic, and it may be due, at least in part, to pandemic-related stress wreaking havoc on our oral health. With the holidays right around the corner, that stress is likely to increase, but our mouths don't have to suffer because of it. Dr. Alan Law, president of the American Association of Endodontists, is joining us to discuss what happens if dental visits have been avoided due to the pandemic and what to do if a dental emergency occurs during the holidays. Thanks for being here, Dr. Law.
Thank you, Sarah.
Well, tell us, what happens if we don't take care of our teeth?
That's a great question. And by the way, you mentioned stress during COVID. Dentists are seeing more and more bruxing or grinding of the teeth and cracking of the teeth and chipping of the teeth. And that's one of the things that can happen if you don't take care of your teeth, is you can get cracks and chips in the teeth, but also certainly cavities. And if you don't take care of those early, it can lead to more expensive procedures. Rather than just a filling, you might end up needing a root canal treatment, or in the worst case, getting a tooth taken out. And endodontists are specialists in saving teeth, so we're trying to help you save your natural teeth.
What does a new survey reveal about how Americans feel about their natural teeth?
Well, first of all, 81% of Americans feel like they should have placed a higher priority on taking care of their teeth when they were younger, and over 70% of Americans are deciding to take better care of their teeth in the coming year, which would mean better flossing, brushing, going to the dentist, avoiding sugary sweets, and even 1 in 5 Americans are saying they're trying to grind and clench their teeth less in the coming year.
Well, who's our first line of defense if we hurt a tooth over the holidays?
That's a great question. First of all, it's important to realize even if your tooth isn't hurting, if it's broken, it's important to get in to see your dentist. But certainly if you're having pain, go in to see your dentist and find out what's going on. The earlier you get in to treat the teeth, the better off you're going to be. And if your dentist says you need a root canal treatment, at that point in time you should be asking if you should see an endodontist, and they can refer you to an endodontist for the care.
Well, how can people resolve to take care of their teeth next year?
Well, the most important thing is prevention again. So get in, get your regularly scheduled appointment. If you still have dental benefits this year, you can get in to see your dentist before the end of the year. But certainly next year, schedule a dental cleaning, avoid sugary drinks, avoid grinding and clenching your teeth. If you do grind and clench your teeth at night, you could consider a night guard, and then brushing and flossing regularly.
Well, Dr. Law, tell us, where can we go for more information?
Well, for information about the safety and comfort and effectiveness of root canal treatments, you can go to our website, AAE.org, for the American Association of Endodontists. And you can find an endodontist in your area by going to findmyendodontist.com.
All right. Thank you so much for giving us this info on Studio 3 today.
You're welcome.
If you are working on grinding those teeth, maybe lessening the stress in your jaw, I know there are some bite guards, mouth guards that you can get, and they really do help, because we've all, let's face it, been under a lot of stress the past 18 months or so with this pandemic. So hopefully that'll help you just a bit and maybe take some of that stress off your shoulders. Well, still ahead.